Hello, my name is Monty Hausman, founder of Medicare Supplements Minnesota. Thank you for watching this video. Hopefully you'll find this video very informative and most importantly, easy to understand. A little bit about myself. I've been licensed here in Minnesota as an agent for 28 years. And so I feel like I've been doing this quite some time already. The only thing I really do is Medicare and Medicare plans. It's really the only thing I specialize in, and I feel like I know all of the companies and all of the plans quite well. I'm also a broker here in Minnesota, which I think is very important. Basically, being a broker, what that means to you is that I'm not married to any company. I have no marriages to any of the companies. I'm very unbiased when it comes to the plan that you may choose. I think that's very important because a lot of these plans that you see or a lot of companies, information you get in the mail, it's that one particular company trying to sell you their one particular plan. I really don't think that's the best way to go about it. I think it's important to have somebody that can search all the plans in Minnesota and has access to really just about anything that's out there. You know, in all of my years of doing this and working with people that are either going on to Medicare or soon to be on Medicare or already on Medicare, the number one complaint that I get more than anything else is the mass confusion of it all. Medicare is very confusing. Not only is Medicare confusing, but you get so much information from so many different sources, it all becomes extremely complicated. People don't know which way to turn. It's really, I think, a problem. You know, if you're already on Medicare, or especially if you're just going on to Medicare, you know that almost every day your mailbox is bombarded, absolutely packed with information from multiple different companies, so many different sources, really everybody and their mother trying to sell you a Medicare supplement. The problem with that is again, I feel biasness creeps in because if you're getting information from just one in particular company, you know, they're just trying to sell you their one particular plan. You're not getting the whole story, or at least you're not able to match it up against other plans to see what might be the best one for you. So that is the number one complaint. So really what I try to do more than anything else is I try to simplify this whole entire process. Because believe it or not, it can be simplified if you're talking to the right person and if you're going about it the proper way. This really can be simplified. I guess what I always try to tell people first and foremost is the fact that, you know, I guess where I'd like to start is the fact that, you know, you get all this information. You go to different websites. You talk to friends and family and neighbors. You know, again, your mailbox is full almost every day. And it appears like there's a million different plans, a million different ways to go when you're choosing your health plan to go along with Medicare. It really isn't so. That's really not the case. You know, it doesn't have to be, again, that complicated. Because really where I like to start and what I like to tell people is it's not how many plans that you're looking at. What really matters more than anything else is what type of plan you may choose. What a lot of people really, what still is not getting through and what a lot of people still don't understand is that there's basically 3 different types of plans here in Minnesota. And the type of plan that you choose, that makes the biggest difference really more than anything else, is the type of plan that you choose. And so much more important than choosing a particular company or looking at a particular company, I think what's more important than anything is to first of all figure out what type of plan you may want. Again, there's 3 different types of plans, and the type of plan you choose is ultimately going to end up impacting what type of health insurance you have. And they are different from one another. So once you can peg down and once you understand the different types of plans, and once you can make a choice and you could say, well, I want to go with this particular plan, for instance, then we could take a look at the companies that sell plans within that type. And it makes it much, much easier. But that's a great place to start. So here in Minnesota, we again basically have 3 different types of plans available. Now the first type of plan that a person could choose is what they call a Medicare Advantage plan. And here in Minnesota we have two, I think maybe three companies that sell the Medicare Advantage type plans. Now, of course, with those companies, they have many different options or plans, but still the framework is all the same. It's a Medicare Advantage plan. And so it really doesn't matter what company you go through. The basic framework of a Medicare Advantage plan is always going to be the same. And so really you want to educate yourself and be educated on what a Medicare Advantage plan is overall to see if it's something you may be interested in or not. And you know, the first thing that a person wants to realize is that with a Medicare Advantage plan, a lot of times I'll get, you know, what is your Medicare supplement? I'll ask a person. And they'll tell me, and it ends up being a Medicare Advantage plan. And what people need to realize is that a Medicare Advantage plan is not a Medicare supplement. It's really an entirely different way of receiving your benefits. Because if a person signs up with a Medicare Advantage plan, basically the framework works very much like this. Is typically the way Medicare will work. And not to go off the subject, but just quickly to explain Medicare. You know, with Medicare you have a Part A and a Part B. Part A of Medicare is your hospital insurance. It really primarily deals with you using hospital benefits, staying the night in the hospital, for instance. Part A of Medicare has no premium to it. It doesn't cost anything. There's no premium to it. They pretty much automatically give it to you when you turn 65. Part B of Medicare is your medical insurance, and that's the part of Medicare that costs about $120 a month thereabouts, depending on your income level and whatnot. And really that is the meat and potatoes of your Medicare, Part B. That's going to be everything from doctor's office visits to one-day surgeries to physicals, all sorts of different things. So Part B is the important part of Medicare. That's the one that you have to choose whether or not you want. Some people that continue working don't take their Part B right away. They'll prolong it until maybe they retire, and then at that point they could purchase Part B. But very important to understand the two different parts of Medicare and kind of what they are and how they work. I'll get back to that later because there is some important things to know about Part B of Medicare when it comes to enrolling into some type of plan and that type of thing. But to get back to the Medicare, just to touch on Medicare again quick, is, you know, the whole reason, to be honest with you, that there's any kind of insurance at all, really, other than you just going on to Medicare and getting nothing else, is because at the end of the day, there's basically three things, for the most part, that Medicare leaves a gap in. And the whole reason that we're even discussing any of this is because most people want to take a look at possibly getting those three things covered. Now, when you're on Medicare, in a nutshell, having Part A and B of Medicare, Medicare, at the end of the day, when all the smoke clears, ends up paying a flat 80% of really anything you have done to you. Whether it's an office call or a one-day surgery or air ambulances, Medicare pays a flat 80% of your doctor bills. You would be responsible for the other 20%. That is the biggest gap with Medicare. That's really 90% of the reason a person looks at getting additional insurance, is really to cover that extra 20% that you otherwise would have to pay for. There's a couple other things that you would have to pay for as well if you just had Medicare and nothing else. If you ever went to the hospital and spent the night in the hospital, really you could go to the hospital for 2 straight weeks, and Medicare really would pay the entire hospital bill, except you would have to pay an initial deductible that's right around $1,300 right now. So you would have to pay that first $1,300. Medicare would take care of the rest, but there is that deductible. That is not a yearly deductible. That is pretty much, I don't want to say per occurrence, but it renews itself every 60 days. So if you had to go to the hospital in January, you'd pay the first $1,300, thereabouts. I forget what it is exactly this year. It's somewhere right around $1,300. Then if you came out of the hospital and you re-entered, even for the same reason, more than 60 days later, you'd have to pay that deductible again. So there is that deductible to deal with if you ever had to go to the hospital. And then Medicare has a once per year $183 deductible on their Part B of Medicare, your medical insurance. So Medicare says you have to pay the first $183 per year before they kick in and start paying their 80%. So at the end of the day, if you just had Medicare, you would be responsible for really 20% of all your doctor bills, that $1,300 hospital deductible if you ever had to go and spend the night in the hospital, and then that once per year $183. Just so you kind of understand how Medicare works and really why we even talk about Medicare supplements and Medicare plans. So getting back to the types of plans, however, because that's, again, very important. Again, the first type of plan is called Medicare Advantage. And although I really can't get into specifics legally with those types of plans, I could certainly tell you the basic framework of those plans. Because again, the whole entire concept of a Medicare Advantage is that when you sign up with a Medicare Advantage plan, what happens is the insurance company steps in and really they become your primary insurance. You're still in the Medicare program, you still have to pay the $120 a month to be in Medicare, but yet Medicare really is not paying your benefits. The insurance company that you signed up with for the Medicare Advantage plan, the bills go to them and they really, in a sense, become your primary. And a lot of people say, well, what does that matter? You don't really care who pays the bills. Well, it does matter in some ways, because when you allow the insurance company to really become your primary, now there's some other things that stem from that, such as, Medicare Advantage plans are the types of plans where you would have networks of doctors and hospitals that you might have to go to. Or if there wasn't networks of doctors and hospitals, you could only go to doctors and hospitals that accept Medicare Advantage plans. And there are doctors and hospitals and clinics here in Minnesota that do not accept Medicare Advantage plans. That could also happen at any time. A doctor at any time can determine or make the determination that he no longer wants to be part of the Medicare Advantage network. And so, you could be seeing a doctor for 20 years, and all of a sudden, if that doctor chooses to be not part of the network or not take that plan, he can do so really anytime he chooses. So that's something that, simply some people don't mind that. Some people do mind that. It's all personal preference. Some other things to know about Medicare Advantage plans is they are not guaranteed renewable, which means basically at the end of every year, when you're with a Medicare Advantage plan, basically that plan is in a contract, a year-to-year contract. And every January 1st of every year is a very important date, because at the end of every year, that Medicare Advantage plan can choose to do a couple of different things if it wants. First of all, it could basically no longer sell its plan, in which case you would have to possibly get other insurance or look elsewhere, or because they could basically say, we're no longer going to offer this plan, you'll have to go find something else. But January 1st is when they can make determinations on how they may change their plan. So they're not guaranteed renewable. And every January 1st, even if they did continue on with the plan, every January 1st is when they can make premium changes to their plan, or what a lot of people don't think about is policy changes. So an issue that I think is out there with the Medicare Advantage plans is that those plans can change the way they work from year to year. So you really never know what kind of insurance you're going to have, because every January 1st they can make changes not only to their premium but to the actual plan itself. So in other words, you may have a $10 co-payment, for example, and they may send you a letter in November saying now it's going to be $20 a month, that type of thing. So you never really know what kind of plan you're going to have. Medicare Advantage plans are usually lower cost plans, which is a good thing for a lot of people. They're going to be usually some of the cheapest plans that you find out there. No question about that. They have some very cheap, inexpensive plans. But what you want to keep in mind is that there's some reasons for that, because Medicare Advantage plans are the types of plans where you're going to have deductibles and co-payments and co-insurance. So a lot of times, again, it's all personal preference, but sometimes those plans people have said are hard to budget for, because you never know what month you may end up having an illness or being sick or go to the hospital. And so you never can really budget for a plan because they do have out-of-pocket expenses. And of course, those out-of-pocket expenses are even higher if you were to go outside of the network. They're not transferable. So some Minnesota snowbirds, will go down to Florida, will maybe move to Florida or Arizona or southern states. You can't take a Medicare Advantage with you if you move. You'd have to cancel the plan, or the plan would cancel, and you would have to find something else. Most of the Medicare Advantage plans also include your prescription drug coverage. And that is one of those things, now that sounds like a really good thing to a lot of people. You'll get your health insurance and your prescription drug coverage all in one package. I don't necessarily think that's such a great thing. I've had some experiences where the problem is when you have that type of plan, where they give you the health insurance and the prescription drug coverage package together, then you really, that's your drug plan. And so if you were to go onto some type of prescription that maybe that plan didn't cover, or maybe it had a large co-payment, the problem is you can't change that drug plan short of canceling your entire health plan, because it's all built together. So I guess the way I personally like to see things happen is, if a person gets a prescription drug plan, I think it's important to keep that separate so you have the freedom and the flexibility to change your drug plan every year, because every fall they give you the opportunity to change your drug plan. You probably have heard about the open enrollment period that starts October 15th and ends December 7th. That is the period of time every year where a person could change their drug plan if they chose to. In other words, if you had a drug plan and you did some research and you found that there may be a much better plan available that was maybe cheaper and the co-payments were better for the drugs you take, October 15th to December 7th is when you can say, I want to change to this other drug plan, and then that would start January 1st. And that's why they have it every year, basically, so that you can check out the different drug plans and possibly get yourself a much better plan and a much better deal. Well, if a person has a Medicare Advantage plan, their drug plan is built into their health insurance, and so if you want to change your drug portion, you really would have to cancel the entire plan. You can't just carve out the drug portion and change that alone. That's just something to be mindful of. Medicare Advantage plans, one thing they do is they include things like extra benefits, like gym memberships, and some will include things like hearing aid coverage or some dental insurance. So that's a good thing. And again, they have very low premiums. So Medicare Advantage plans absolutely serve a purpose. Again, they're going to be your lowest cost type plans, but you want to understand the basic framework of a Medicare Advantage plan and what they are, and if that's something you're comfortable with. Now, we here, just personal preference and choice, we do not sell the Medicare Advantage plans. It's just not something we choose to sell. But if that's something that maybe you want, we could certainly tell you about some of the plans. We'll do anything we can to help. Get you phone numbers, website addresses. We'll certainly turn you in the right direction. We again pride ourselves on being completely unbiased. We just choose not to work with those particular plans. The next type of plan that's available here in Minnesota, and we're actually somewhat lucky to have these plans because there's a good number of states, many states, that don't have these plans at all, but we do have them here in Minnesota, and they're called Medicare cost plans. And they're somewhat under the umbrella of Medicare Advantage. They are considered a Medicare health plan, but they're called Medicare cost plans. And here in Minnesota, we have 3 different companies that sell those. And Medicare cost plans, the framework of those plans, they have a lot of similarities to the Medicare Advantage plans, but they also have some big differences. Like a Medicare Advantage, if you get a Medicare cost plan, the insurance company is going to step in, and they are, in a sense, going to become your primary insurance. One difference between Medicare Advantage plans and cost plans is that with a Medicare Advantage plan, again, the insurance company is going to be your primary insurance. You're going to go to their network of doctors, hospitals, or doctors that will accept their plan. If you go outside of that network, then you may be responsible for all of the charges, because there really is a lot of times not Medicare to fall back on. They don't work in such a way where if you don't go to the doctor that they have in their network, then you can at least fall back onto Medicare. It really doesn't work that way. But with a Medicare cost plan, it does work that way. So Medicare cost plans, they also have networks of doctors and hospitals. They have very generous travel benefits, so you can basically go anywhere you want in the country and for up to 9 months, and you're going to be covered just the same as you were right here in Minnesota. But if you did go outside of the network to a doctor that wasn't part of their network, then at least your coverage would revert back to Medicare. So in other words, say for example, and I always use this as a great example, I think, is I always think of a person, I always see this Cancer Treatment Centers of America. It's on TV all the time. And I think, well, geez, if one of my children or if my wife or if I got cancer, I might want to go to the Cancer Treatment Centers of America. Well, more than likely, you're not going to be able to get a referral there. It's not going to be part of the network. So if you wanted to go out of state to a specialist, something like that you know is not part of the network, then if you had a cost plan, at least it would revert back to Medicare, and you know that at least 80% of the bill would be covered. You'd still have to pay money out of your pocket, but it wouldn't be like you had no coverage at all at that point. So that's important difference. Cost plans are not guaranteed renewable. So at the end of every year, like a Medicare Advantage plan, that's when they can change their premiums possibly. They can change the way the coverage works. Or they can really end the plan entirely if they wanted. So that's a very important thing to be aware of. As far as deductibles, co-payments, and co-insurances, most cost plans will have, for instance, if you take a particular cost plan company, they'll have 3 different levels of plans. They'll have kind of the cheaper plan, then they'll have the middle of the road plan, and then they'll have their most comprehensive plan. Most people get the most comprehensive plan. If you do that, you're really not going to have any deductibles or co-insurances or co-payments for the most part if you go with the most comprehensive plan. Really the only thing, if you went with the most comprehensive plan, you're not going to have as much come out of your pocket. Let's put it that way. Those plans, Medicare cost plans, do not automatically include prescription drug coverage. They do have options where you could get a prescription drug plan through the company, but they don't automatically package that in. They also offer things like gym memberships and some eyeglass coverage and things like that. So those are the Medicare cost plans. Again, very similar in a lot of ways to the Medicare Advantage, in some ways very different. The third type of plan that we have available here in Minnesota are Medicare supplements. Everybody's heard of those. And here in Minnesota we have roughly about 18 companies that sell Medicare supplements. And Medicare supplements, the framework of those plans, really is almost the complete opposite of the Medicare Advantage and the Medicare cost plans. They are, of course, going to be, they're going to cost the most, but they are different. Because with a Medicare supplement, first of all, your Medicare stays your primary insurance. So Medicare stays your primary insurance. Your Medicare supplement does just what it says, is it comes behind as your secondary payer, and it supplements your Medicare. So that's a big difference. Of course, because of that, then, there is never any such thing as a network of doctors or hospitals you have to go to. You basically go anywhere you want, anytime you want. You don't have to get referrals. As long as the doctor participates with Medicare, you can go to them. You don't have to call the insurance company or anything like that. So that's a big difference. Some other things is Medicare supplements are guaranteed renewable, which means once you get a Medicare supplement, they can never take it away from you. There is no contract with Medicare. There is no point in the year. January 1st is really just like another day to a Medicare supplement. So there is no point in the year where they raise your premiums or change your benefits. The benefits of a Medicare supplement really never change unless they change in according with Medicare. So in other words, if Medicare increased their hospital deductible to $1,400 next year, the Medicare supplement would then adjust itself and pay the $1,400. So, but you don't have to worry about your policy itself ever changing in a negative way because it works in complete lockstep with Medicare. And it's also guaranteed renewable, which is important if you have health conditions and health problems. With Medicare supplements, you're generally not going to see any kind of deductibles or co-insurance or co-payments. Medicare supplements they're very, very simplistic. I think it's kind of funny sometimes. Whenever I walk into a home and if somebody has a Medicare Advantage or a cost plan, if you purchase one of those plans because they're kind of acting as your primary insurance, they're going to send you a book that's that thick. And then of course there's going to be another book which is the network book and it's going to be that thick. And because they're acting as your primary, they have to list out everything that they cover and how it's covered and where it's covered and all these different things. With a Medicare supplement, one really nice thing about them is their simplicity. It's not pages thick. Basically, it's 3 pages long as your booklet because it basically says Medicare pays this, we pay the remainder. Page 1 will say Medicare pays 80%, we pay the other 20. The next page will say Medicare, their hospital deductible is this much, the supplement pays that for you. So simplicity is a big thing with Medicare supplements. There's also never any paperwork, really, with any of the plans. Medicare supplements are transferable. So if you were to ever move or leave your area or move to a different county or state, you take your Medicare supplement right with you. There's no issues with that. Medicare supplements do not include the prescription drug coverage. If you wanted a prescription drug plan, you'd have to purchase that separately. No Medicare supplements offer drug coverage or have drug coverage you could package with it. And like I say, that's actually a good thing because really, and we'll talk about the drug plans in a minute, and they can be confusing, but the drug plans, it's important to keep them separate, I think. And again, most Medicare supplements do not have things like gym memberships. There really is no Medicare supplement that I'm aware of that gives a gym membership or any of those other kind of little freebies that you get with the Medicare Advantage and cost plans. So again, the Medicare supplements, just to kind of recap, and then how they differ really quite a bit from Medicare Advantage and cost plans is your Medicare is going to stay your primary insurance, where the other 2 plans, it's really not. The other plans have networks of doctors and hospitals. Medicare supplements do not. Medicare Advantage and cost plans are not guaranteed renewable. Medicare supplements are guaranteed renewable. The other plans can have deductibles and co-payments and co-insurances, and sometimes they can be quite large depending on the plan that you get within that type. Medicare supplements really don't have any out-of-pocket expenses unless Medicare doesn't pay, which is another important point that a lot of times doesn't get explained to people, and that is that if Medicare does not pay for a particular service, then neither will your Medicare supplement because there's really nothing there to supplement. Fortunately, there's not very much that Medicare doesn't pay for these days, but some of the big things are like dental. Medicare does not cover dental unless it's some type of injury, but they don't cover, cleanings and x-rays and that type of thing, so then neither does your Medicare supplement. Medicare doesn't pay for things like acupuncture, so neither will your supplement. So be mindful of that. It's usually never an issue. Probably the biggest thing is when it comes to physicals. Medicare does not pay for a routine physical. So there are some steps you have to take and some things you want to be aware of there. But again, those are some of the ways that those plans differ. Again, with your Medicare Advantage plans, they're typically going to be your lowest cost plans. The Medicare cost plans are going to be your middle of the road costing plans. and the Medicare supplements are generally going to be your most expensive plans. So at the end of the day, like everything else, it is all somewhat relative. And so again, what I think is most important than anything else is you to understand the different types of plans we have available here in Minnesota. Again, the Medicare Advantage plans, two, I think maybe three companies that sell those. We just don't deal with those here at our firm. Then you have the Medicare cost plans. There's three companies that sell those here in Minnesota. And then we have the Medicare supplements. There's about 18 companies. A couple of really important facts about the real Medicare supplements. And, you know, I shake my head all the time at the fact that how much information is out there, how much information you get, again, in your mailbox, the seminars that people go to, things of that nature. You know, all this information that you receive, yet some of the most important things there are to know, it seems no one's telling anybody about. And I think it harkens back to the biasness issue. But one extremely important fact about the Medicare supplements is that by law, they are all mandated to offer the exact same coverage. Well, that's really important for you to know, because what that means is we basically have 18 different companies. And by law, those 18 companies, and you know, they all have to offer the exact same insurance. The difference is that they offer that insurance for sometimes vastly different amounts of money. So really no different than car insurance. You can have two different car insurance companies have exact same coverage between the two of them, but one company will charge this much and the other company will charge this much. And so what's really important, which never kind of seems to seep through to people, is the fact that, for instance, if you were to call us and say, well, and talk to us further, and we kind of go through these different types of plans, and you say, well, I think I've made my decision, I think I want to look at the Medicare supplements. Well, then we can say, great. But at that point, then it becomes extremely simple as to which company we should choose. Because again, by law, all of the Medicare supplement companies have to be identical to one another as far as the coverage that they offer. So therefore, it really becomes nothing more than a price issue. We want to find what is the cheapest priced Medicare supplement in your area, because that's the plan we want. Now, of course, other things matter, like, you know, strength of the company and maybe their claims paying track record and their premium increase track record. That stuff matters. But really, at the end of the day, it's a price issue. And if you get to the point where if you look at these three different types of plans and you say, I've decided, I've looked at these different types of plans and I want to go with the Medicare supplement, then that would be quite simple to figure out what plan we should go with. One really important thing, and if you look up top in the tabs on the website, you'll see that there's some important links. And one of the links is right to the Commerce Department's website. Now, the Commerce Department here in Minnesota, every year they put a sheet out, and this is the sheet. And this is what they call the annual premium guide for Medicare supplements here in Minnesota. They do a real nice job. They've been doing this for years. The last time this was updated was September of 2016. So sometimes the numbers are a little off, and because it's a little old, companies will have rate increases, but it's pretty close, pretty accurate. And this is an invaluable tool. We use this on a daily basis because what this is it's a list of all the Medicare supplement companies in Minnesota and their current prices. So we very easily could look at all the different plans, all the different Medicare supplements in Minnesota, and we can find the cheapest price plan in your area. So again, if you say, we've done our research, we want to go with a Medicare supplement, then it's really no more difficult than finding the cheapest plan in your area and getting that plan. Same thing with the Medicare cost plans in a lot of ways. Again, there's three companies with the Medicare cost plans. They have some differences between the three different companies that sell them, but they're minor differences. We can talk about them, and at the end of the day, we really just want to go with what is probably the plan offering the best deal. You know, there's only three of them. And so if you want a Medicare cost plan, again, if we've done our homework and you understand how all these plans work, and you say, I think I'd like to look at the Medicare cost plans, then we could say, well, here's the 3 plans that sell them. Let's take a look at these plans. Let's take a look at the, some of the particulars, and let's take a look at the premium, and then we can find the best one. And that's the way to do it. If you kind of want a Medicare Advantage plan, again, we don't sell them here, but we could certainly help you and turn you in the right direction. Again, phone numbers and whatnot. So that's all very important. And again, this premium guide that the Commerce Department puts out, I would really encourage you to click the link, go to the Commerce Department. That's what this is for. They make this sheet for everybody to see. That's why they make it. And so you should really know that it's available. I talk to a lot of people all the time and have for many years, and unfortunately a lot of people don't know that this even exists, but this is a great thing to look at, and again, they update it about once a year. Another thing that you might want to click on with the links is, most people that are either on Medicare or going on to Medicare, you've received that real thick Medicare and You handbook. Which is a good book to read. Of course, it explains Medicare in a lot of detail. But there's another book available for us here in Minnesota, which again, I talked to a lot of people, and a lot of people have never even seen this book. But it's put out by the Minnesota Board on Aging. And it's called Healthcare Choices for Minnesotans on Medicare. And this is really a fantastic book. They do a superb job. And it's really important that a person maybe looks at this book, because it gets very specific to the types of plans, everything we're kind of talking about, to just us here in Minnesota. Just a couple of pages that I ripped out of here. It'll give here, for instance, all the Minnesota cost plans, all the Medicare Advantage plans available, all the Medicare supplements. It has a copy in their book of this very same premium guide. It goes through everything, like I say, in a lot of detail. It explains Medicare Advantage plans and cost plans, and again, how plans are offered by private companies, and the plan itself is who covers the Part A and Part B benefits. So, great book, and I would really encourage a person to go and click the link and read that book, or download it so you can read. It's really a fantastic book. So again, just to summarize a little bit, again, I've been doing this for many, many years. 28 years I've been doing this. And the only thing I do are these types of plans, and Medicare and the prescription drug plans. I really specialize in this field. And again, there's a lot of confusion. Nobody ever knows which way to go. Everybody's telling them something different. Biasness creeps in. I always tell people, these seminars that they throw, things of that nature, you could certainly go to a seminar and get some coffee and some cookies. And they may tell you some great points about Medicare that you maybe didn't know, and that's a great thing. But make no bones about it, at the end of the day, these seminars are there for one purpose, and that's to sell you their particular plan. And I think the problem with that is that unless you're getting the full scope of all the plans, unless you're able to compare and contrast all the different plans, you might be doing yourself a disservice by that. But again, you got all these different, what appears to be different ways to go. And so really what we want to do is simplify this. And we want to say it can be simplified. Because again, to summarize, you want to take a look at what type of plan are you comfortable with. Do you want a Medicare Advantage type plan? Well, you really want to be educated, and you want to educate yourself, and we want to educate you as far as what a Medicare Advantage plan is, how they work, some of the particulars of those plans, as far as, are they guaranteed renewable? Do you have networks? Those types of things. And if you want a Medicare Advantage, then, again, you go get a Medicare Advantage plan. Do you want a Medicare cost plan? Do you want a Medicare supplement? Again, once you determine what type of overall plan you want, then we could take a look at the companies within that type, and it becomes very simple after that. Especially, again, when it comes to the Medicare supplements, because by law, they all have to offer the exact same thing. So to summarize, we really want to keep this simple. Now, once you've made that choice, and we maybe can get you to the point of you saying, this is the type of plan I feel comfortable with, so therefore maybe this is the company I want to choose. Then, of course, we have the whole prescription drug issue to deal with. Because nowadays, and probably really for the past 11 years, they've had the prescription drug plans that are also available. And the prescription drug plans, they can be very confusing. Here in Minnesota, we have 22 plans. 2 of those plans right now are under Medicare sanction, so they're unable to be sold. So really, we have about 20 plans right now. Now, the Medicare drug plans, they're the complete opposite of, say, for instance, Medicare supplements. The Medicare drug plans, those 20 plans, they are all completely different from one another. They all have different premiums. They can have different deductibles. They all cover drugs differently. One plan may cover a particular drug with a $10 copayment. The other plan may have a $4 copayment. The third plan may not cover that drug at all. So the problem is, and this is really a problem, and a lot of times I'll say to people, to be honest, choosing your health plan is actually sometimes the easy part. Again, choose one of the 3 types. Then we can find easily what plan or what company within that type almost becomes the easy part. The drug plans, people really tend to overlook, because the type of drug plan you get, especially if you take a lot of prescriptions, becomes critically important that you do the right thing. Because the drug plans, the difference is whether you get the right plan or the wrong plan, it can mean hundreds, even thousands of dollars a year, I've seen. And so it's really critical that you choose the right drug plan. So with the Medicare drug plans, again, there's 20 plans. You again get all kinds of information in the mail. You may have a friend or a family member tell you, hey, this is a good plan. You really never want to do that. You don't just want to haphazardly go and buy a drug plan because you may have heard it's a good plan. You also don't want to buy a drug plan based on the monthly premium of that plan. I know this sounds really funny to say, but with the prescription drug plans, the premium in a lot of ways doesn't matter. And unfortunately, what people will do is they'll go and buy the cheapest drug plan thinking that they're getting a good deal. Well, the problem with the drug plans is there's a lot of moving parts. And so you may go get a drug plan that's a cheap plan, but if that plan doesn't cover the drug you take, then it doesn't matter if it's a cheap plan. Or if it covers your drug but it's a high copayment, you might have been better off with a little bit more expensive plan that covered your drug in a better fashion. So it's really critical that you, again, get the right drug plan. Now, we don't even sell the drug plans. I don't sell the drug plans, which means I'm extremely unbiased when it comes to the drug plans. Don't sell them here at all. We actually do something I think that's even better than that. What we do for all of our clients, and we do this completely free of charge, we spend a lot of time every fall doing this for all the clients that we have, and we really have hundreds and hundreds and hundreds of clients from one corner of Minnesota to the other. We do this for every one of our clients just because it's the right thing to do. We don't make any money doing it. We do it completely because it's important. There's only one thing and one thing only to do when it comes to the drug plans. And that is the type of drug plan that you should have, or in other words, which one of the 20 plans you should get, is really entirely dependent on what your particular cocktail mix of drugs is. One person may not take any prescriptions at all, and so that would warrant them getting this particular plan. Another person may take all sorts of prescriptions, including expensive non-generics, and so they would need this other different plan. Well, there's only really one true way to figure all that out, and that is Medicare has a website on the internet, which is medicare.gov. And on Medicare's website, there's a tool available for everybody to use. And basically what you do with that tool on medicare.gov is you punch in all the medications that you take. You want to get specific as possible. You know, what the dosages are, the milligrams, how many you take per day, that type of thing. You also, there's a section in there where you punch in what pharmacy you like to go to. You want to make sure you put in the right pharmacy that you go to. That can make a difference. And you hit a button. And what Medicare will do is they'll take all the complicated mathematical equations and they'll figure it out and according to your particular prescriptions, and they'll give a list of all 20 plans, with plan number 1 on the list really being your very best option for your particular mix of drugs, plan number 20 on the list being your worst option. So really Medicare will tell us exactly the very best drug plan for you to get according to your particular prescriptions. So basically what we do is we make sure that all of our clients give us a list of the prescriptions that they take, and then basically we just take that list, we enter it into the Medicare website. Medicare will tell us exactly what drug plan would be best for your situation, and then we'll make sure you get that drug plan. You have to call and get the drug plan yourself by either calling Medicare or the drug plan. It takes about 15-20 minutes on the phone, and we'll make sure you get the right drug plan. A caveat to that, which is extremely important, and that is that every January 1st of every year, all of the prescription drug plans change. And it's very important that we stay on top of things, because what happens is that if you call us up, you can give us a list of your drugs, and if you're a client of ours, we're going to do that work for you, and we're going to find you the right drug plan and make sure you get that drug plan. We can give you the Medicare printout and everything. But when Medicare gives us that information that they give us is only good for the particular year that we're in. So in other words, if you gave us a list of your drugs, we could find out exactly what the very best plan would be for you for the remainder of this year, for 2017. But come January 1st, if that company that was number 1, if they double their premium and double the copayment on 3 of your prescriptions, they're probably not going to be number 1 any longer. So every January 1st, the entire deck gets reshuffled. And so every year again, during what they call basically everybody calls it the open enrollment period, which goes from October 15th to December 7th, that's the period of time that we have to take a look at your prescription drugs again, your situation. Because every year by October 15th, all of the drug plans have to announce what their new plans are going to look like for next year. So by October 15th of every year, we're able to take a current list of your drugs, and maybe your drugs have changed, and we can give that to Medicare, and then Medicare will tell us the best plan for you to be on next year as well. And maybe it doesn't change. Maybe the plan that was number 1 this year is going to be number 1 next year, therefore you don't have to do anything. And then it just automatically renews January 1st. But if your plan that was number 1 this year slips down to number 10th next year, you don't want to have the 10th best plan. We want to make sure you always have the number 1 best plan. So therefore we can tell you about that and get you the printout and instruct you to call that plan and get the other plan. And again, it's something we do completely free of charge for our clients, just because it's a really important thing to do. If you look at that list that Medicare gives, it will generally give you a yearly out-of-pocket what you would have to pay for. It includes the premium, all of your co-payments, any deductibles you may have to pay. And really the difference between plan number 1 on the list and plan number 20 can literally be thousands of dollars. So it's really important that not only do you get the right drug plan, but you keep the right drug plan every year. Otherwise you could actually just end up hurting yourself, and eventually you wouldn't have the right drug plan, or at least the cheapest drug plan. And our goal is to help your pocketbook as best as possible. So that's really important. Another really important thing that we didn't mention, that I'll mention about the Medicare supplements. And again, this is one of those things where you get all this information, but some of the most important stuff it seems like it's never explained to people. But with the Medicare Advantage plans and the Medicare cost plans, there really is very little to no medical underwriting to get those plans. Unless a person really has certain things like end-stage kidney dialysis, renal dialysis, those plans, they really have no medical underwriting. Pretty much everybody can get those plans. It doesn't matter what your health is. The Medicare supplements, again, are the opposite of that. to get a real or to get a Medicare supplement, they have medical health questions, and Medicare supplements have medical underwriting. They generally have a list of about 20, 25 questions, and if you answer yes to any of those questions, then you cannot get the Medicare supplement. There's things like, any recent cancers in the last couple years, any heart attacks or heart issues in the last couple years. A big one here in Minnesota is diabetes. We run into it almost on a daily basis. If a person has any form of diabetes, really even diet controlled, you don't even have to be on medication or insulin, then a Medicare supplement will not accept you. There's only one time really in your life when you're able to get a Medicare supplement, and that is 6 months either way of your Medicare Part B start date. Now, for most people, like we had talked about in the beginning, for most people, your Medicare Part B is going to start when you turn 65. That's when most people, of course, go on to Medicare. Medicare is always going to start the first day of your birth month. So if you were born in July, Medicare is going to start July 1st. And so, but it really hinges on your Part B, whenever your Part B starts. Medicare says if you can apply for a Medicare supplement, and if you do it 6 months before your Part B starts or 6 months after your Part B starts, then the insurance company cannot medically underwrite. They have to give you the insurance. It's a guaranteed issue product at that point. So when a person's first going on to Medicare, then there is no issue. Anybody can get a Medicare supplement. But if you tried to get a Medicare supplement after the first 6 months that you're on Medicare, and if you had things like diabetes or recent heart issues or heart stents, really for the rest of your life, Medicare supplements are going to have medical underwriting, and you might not be able to get a real Medicare supplement if you wanted one. That's a very important point. So again, if a person wanted a Medicare supplement, you're only guaranteed to be able to get a Medicare supplement around that age 65 point. 6 months before you go on to Medicare Part B and 6 months after. So for some people that continue to work, you don't necessarily have to be 65. A person will continue working, and maybe they work until they're 67 years old. Now they say, I want to retire. Now I'm going to take my Part B of Medicare. Then that starts, the clock would start ticking, hovering around your Part B start date. And again, that's an important thing to remember because a lot of people don't understand all that. Sometimes we'll talk to people and they'll say, well, I can change my plan once a year and go get something else. But really, you're only guaranteed to be able to get a Medicare supplement around when your Part B starts or when you first go on to Medicare. So, for people that may be watching this that are already on Medicare, maybe you have a plan that you're not happy with that's not a Medicare supplement, and you would like to change to a Medicare supplement. You can do that. Not any time of the year, but depending on the plan you have, you can apply for a supplement, but that supplement company may not accept you depending on your health, and that's just something that again a lot of people don't get to hear about. A couple other quick things. Another way that we can help people, and something that we do here. A lot of people don't know about this, is that, and this again is in that book put out by the Minnesota Board on Aging. Again, I would really encourage you to download that. But another thing we can talk to people about is there are some county and government programs that you may qualify for depending on your income. Like we had talked about earlier, with your Medicare Part B, generally costs people about $120 a month. If you were a higher income earner, it could be more than that. But if you're a low income earner, depending on how many people live in your house and what you're taking in on a monthly basis, there's programs through the county that we could tell you about that would actually pay your Part B premium for you. It would pay that $120 for you, and you may qualify for that. So it's something we can help you out with, give you information on. There's also a program through Medicare called the LIS program. It deals with your prescription drug plan. Lower income people, or actually that's even easier to qualify for, depending on husband and wife status and things of that nature. If you qualified for the LIS program, and they actually have different qualifying levels, you may get some or all of your premium covered for your prescription drug plan, depending on your income level. If you qualify for that LIS program through Medicare, they also things change as far as what you would have to pay as far as co-payments and whatnot. So that's something we can help you with. Certainly point you in the right direction, get you the number to your local county office and things of that nature. So hopefully some of this has been informative for you. Hopefully I didn't get too much in the weeds, because our goal here is to simplify this and make it simple for you, because otherwise a lot of times it is very confusing. So hopefully you learn some things. Hopefully you can see things in a little different light or a little different way, and see that they can be simplified. And please, if there's anything we can do to help, we would love to work with you. We would love to have all of you as clients. We know what we're doing. It's really all we do. And please give us a call at the number. Download or look at some of the things we have on the website as far as links and whatnot. But please give us a call anytime. Call me directly anytime at 1-800-420-8298. And thank you so much for watching.